Well, hello everyone, and welcome to the Future of Scientific Conferencing Workshop, Track 1. This is focused on promoting diversity and inclusion in scientific conferences and meetings. I am Marie Bernard, the NIH Chief Officer for Scientific Workforce Diversity, and I will be moderating this panel focused on cultivating inclusivity, advancing diversity and equity in scientific convenings. In this session, we will hear a brief, no more than 12-minute presentation from each speaker. After all of the presentations, we will engage in a group moderated discussion, including questions that you have submitted. At any time in the session, you can use the Q&A function to submit your questions, and you may also use the chat function to share your thoughts and engage in discussion. The questions will be, I, as the moderator, probably with a little bit of help, will select from the questions because I'm sure you'll have many more questions than we can get to. I'm really honored to introduce the speakers for this session. For full information about each speaker, you can access the speaker biography and headshots located in the Labroots platform. But just in brief, we have Dr. Michelle Joseph, who's an instructor in global health and social medicine and visiting fellow in the program in global surgery and social change at Harvard Medical School. Dr. Carmen Corona-Sobrino, who's an assistant professor at the University of Valencia, and Dr. Sarvenaz, Sarabipour, who's an assistant professor in the Richard D. Berlin Center for Cell Analysis and Modeling, Department of Cell Biology at the University of Connecticut School of Medicine. So we will begin first with a presentation by Dr. Joseph.
Hello, everyone. Thank you very much for the introduction. It's an absolute pleasure to be here, and I will get started with this presentation. Okay, so we'll be talking about conference equity, and I'll explain what that means as it relates to global health and whether this is a technical or adaptive problem and how we house it in the context of equitable access to scientific conferencing. So you've heard a little bit about me. Yes, I'm faculty in the Department of Global Health and Social Medicine, and the work that I do is centered around health equity, anti-racism, curriculum development, and trauma system strengthening in relation to civilian military integration. So in order to understand DEIAB in the context of global health, we have to really interrogate our understanding of psychological safety and intersectionality. When I think about psychological safety, using frameworks that have really been elaborated by Amy Edmondson, we think about 4 stages. The inclusive safety stage, the point at which you are a new learner and able to step into an environment where there is understanding that you are new, but there is acceptance and you are valued. The learner safety area where you are able to further your understanding and your knowledge, and there is comfort in this space. And following that, contributor phase of your development in the safety channel, where you have ability to actually add to the scientific literature. It is critical that one must be able to feel able and therefore bring their full selves to do so. And once you have your full self in this space, innovation is possible, whereby you are able to challenge the status quo. But what happens when you can't get there? And what are the barriers that prohibit you from doing so? We think about them often in terms of intersectionality. I think this is a good way of looking at it, but to understand the barriers, we have to look at what global health conferences actually stand for and what the purpose is. Best practices happen at these global health conferences. It's a point at which things start to develop within this sector, within this area of academia, within this area of policy development. But it's also an opportunity for networking, for establishing collaborations, and for moving the needle. However, when the agenda isn't set by you, if you are from a low and middle income country, those who are predominantly affected, there are many factors that are in place here. Your gender matters, racism matters, and the level of stigma and discrimination. And yet we understand if there is governance in this space, we can possibly overcome the power. If we look at this triangle more closely, when we think about the different isms, and this list is by no means exhaustive, but it is to give you an example of the different components which intersect, which affect how we potentially get to that point where we're able to contribute fully. We're on that scale towards the challenger safety mode. So racism, sexism, heterosexism, and classism all can be at play when it comes to being a barrier to achieving global health conference equity. In addition to that, we think about the powers that happen at all of those levels and who really is in charge and how we overcome that. Well, we require some level of governance in order to overcome that power. And understanding how we establish that governance means that we must understand the context, and the context is very complex. So why do we look at it? Well, if we want to try and impede the barriers, we must establish the right people at the table and those who can really engineer and develop the discourse of global health. Participants are key to this, and there are various aspects of a participant that impact their ability to contribute and engage in these conferences. Geography matters, location matters, because your passport is dependent on your origin. Your ability to connect, technology, and how viable and stable the resources are in order for that technology to work well. And another speaker will reference the positives of virtual conferences. I want to highlight some of the potential barriers that occur for participants who are in vulnerable states, where there is challenges with electricity, where there are challenges with the cost of paying for that internet connectivity. These barriers, these technological barriers, are related to resource and finance. So participants from some LMICs and within those countries may not have the same level of access. When we think about those who organize these conferences, they really think about the different domains in health that are priorities for that conference. Finances are required in order to develop those conferences and for those conferences to have sustainability. If this is done well, if we're able to have the level of engagement that is required to advance healthcare of the right people, the participants, those who are simply joining, but also those who are really establishing what the priorities are for these conferences. If the demographics are right, then we manage to get the right epistemological setting. However, there are some sociocultural elements that may not also allow for this architecture, which we display here in terms of equity, effectiveness, accountability, and solidarity. And a lot of this language, this framework that I'm showing here, comes from health system thinking. And I do think about the fact that conferences reside within the system, and the system, unfortunately, elements of it can prohibit this flourishing of the global health governance within which this resides, within which active engagement, the opportunity of active engagement resides. Some of the barriers that we think about in this space can be political, it can be legal, it can be economic. We've alluded to that when it comes to the technological component and the resources and your passport power. Sponsors and donors really do determine the themes, and we need to understand further some of the complex structural barriers, and that requires data that interrogates this question. As most things start off with a story, we were really compelled to look at these conferences and how they function and what the barriers are, equally what the facilitators are for participants. Our colleague, Auric Henmunier, was unable to get to the World Health Assembly, one of the largest conferences that occurs and one of the most well attended in terms of those who are the movers and shakers when it comes to establishing a global health discourse. We identified that his problem was not unique, and as such, we determined that it was important to form a collaborative group and look at the data that has had been performed, had been collected by others. One of the things that we wanted to make sure in doing this work that we really held on to the values of health equity and those of global health research justice as established by Bridget Pratt. Looking at the data from a systematic review lens, we saw that the majority of conferences were held in high-income countries. And of those who attended those conferences, the majority were indeed from high-income countries. In addition to that, if you had an institutional affiliation to a high-income country, you were more likely to attend these conferences. Further barriers were limitations in speaking opportunities, the visa restrictions, the finances we've discussed, the political barriers, and also racism. There were facilitators. These things included scholarship, administrative support, such as letters supporting their visa, guaranteeing that they would come back to their native country, empowering their research acumen by assisting in abstract writing and opportunities to submit, but also relocating conferences to locations where it was harder to get to if you were from that country. We did a retrospective analysis of over 36,000 individuals to understand what kind of conference they were going to in terms of geographical location, but also how this impeded the proportions depending on where the conferences were held. And as you can see from these pie charts, when conferences are held in low-income countries, there is a higher number of individuals who are able to attend from that category. As you can see here, when conferences are held in HICs, the number drops from 48% to 7.8%. There is a lot of work to be done. And this graphic here demonstrates that when you are able to relocate to a low-income country or a lower middle-income country, there are greater levels of attendance, irrespective of whether you have facilitators available, such as the scholarships and the advocacy letters that I mentioned. Further, when we look at the number of conferences without any of these facilitators, again, to further push that point forward, you see that the numbers are higher for those who are from have conferences and LICs that are not requiring facilitators. Further analysis of this is to really understand some of the nuance, and that requires qualitative data. We need to understand what the barriers are and facilitators are on a more nuanced level. And for that, we divided it into 3 buckets of people who attended in person, either presenting or just attending, the nature of hybrid conferences and virtual conferences. Within those, there will always be people who are unable to attend, and it's important to understand what their barriers were and equally what helped those participants attend those conferences. Not only the participants, we also need to look at the conference organizers and understand what their barriers are so that we're able to further support their endeavors in trying to establish more equitable practices as it pertains to conference organizing. We worked with a number of different conferences, interviewing organizers, and through that, as well as organizing a consensus statement exercise, which was conducted at the Conference in Public Health in Africa last year in Zambia, which had over 5,000 delegates, we were able to put our data together to build a consensus statement and recommendations. And the recommendations center around visa practices, not only at the governmental level, but also at the conference organizer level and sponsors. The reason why that's important, because governments have the potential to leverage the ability to allow people into the country by having these temporary waivers, which support the advancements that we really intend to see in global health. In addition to visas, we also looked at funding as well as inclusive participation. And inclusive participation looked at the barriers that people face as it related to access. Language was important, the mode of communication was important, wheelchair accessibility was important, visibility was important. It was really key for us to ensure that we were able to have a diverse group, and the recommendation would allow for that to happen. Further to this, we have developed a framework And our next steps on this journey is to really establish an index which has metrics, and metrics that allow us to really understand what the challenges are for development of this framework adoption by all the global health conferences that have over 500 candidates. So our next steps are to perform the modified Delphi, followed by dissemination of the framework I've just shown you, and really to have the index taken up by the majority of global health conferences, and work with our conference equity working group to further help individuals in this space really move forward towards narrowing the gap as it relates to all the equity barriers. So with that, I leave you with this. I encourage you to fill out our survey if possible and move on to establishing some level of conference equity for all. Thank you very much for listening.
Thank you so much. Our next presenter is Dr. Carmen Corona-Sobrino.
Hi, thank you very much. Good morning, everyone. I'm Carmen Corona. I work as an associate professor at the University of Valencia in Spain in the Department of Sociology. First of all, thank you for organizing such a wonderful event, and thank you for the presentation. Today, I would like to present our work titled Monitoring and Assessing the Gender Gap in Events. This research was developed with my colleagues Mónica García, Jane González, Rocío Poveda, and me, and was funded by the Open Society Foundation. We conducted between 2019 and 2022. The importance of participating in academic conferences is well known to all of us. It's not only useful for getting feedback and improving our work, but also for career development, building networks, and increasing the visibility of our works. However, numbers reveal disparities in the proportion of female to male speakers, differences in presentation times by gender, and an imbalance in the number of female members on organizing committees, among others. For all these reasons, the goal of our project was to identify all the relevant perspectives or dimensions related to the gender gap in academic conferences and to design a specific list of performance indicators. These measures allow the organizer of academic conferences to monitor the performance according to each specific dimension. Performance indicators are intended to shape behavior and practices in the right directions. Just an overview of our methodology. Our tool is based on a combination of a multi-criteria technique, the analytical hierarchy process, AHP, and a qualitative analysis based on in-depth interviews and 2 focus groups. The use of the AHP has allowed us to weight the indicators according to the opinions of several experts. The results are shown using a graphic live visualization approach. This method helps us to present the result for each indicator clearly. You can find more details about our methodology in our paper. I will provide the name of the paper at the end of the speech. We divide our field work, into 3 different stages. The first stage was the generation and prioritization of indicators using different techniques, such as literature reviews, in-depth interviews, and participatory sessions. The second stage was event monitoring, which was conducted either live or online. To perform this monitoring, we gather information during and after the event. For example, we measure the time spent speaking by women and men, or who made the first question in a plenary session, for example, among others. The stage 3 was the proposal for improvement actions. We developed to focus group and analyzing the result to propose improvement actions that I'm going to tell you more before. Here you can see the list of indicators. Our study identifies 3 relevant perspectives or dimensions. The first one is female participation in scientific conference or events. The second one is organizational structure. And the last one is gender attitudes perception. We designed a specific list of performance indicators for each of them, as you can see. For example, for the first dimension, we measure the number of women who attend the conference or the number of women who ask the first question. In the second dimension, we consider organizational aspects such as the organizing committee or track sessions that involve gender issues. And the last session is from a qualitative point of view, addressing invisible issues such as social dynamics and staging. We monitor 7 conferences and political events during 2019 and 2021. Due to the COVID-19 crisis, the conferences took place either in person or online, so sometimes we had to adapt our indicators. There are the political events, all of them are at the European level, covering a variety of topics such as security, European affairs, and economy matters. Each event has around 2,000 attendees. On the other hand, we also monitor academic conferences. We are not comparing political events and academic conferences, but the funder was interested on political events, so we also did it. The academic conferences also cover a broad range of disciplines and levels. We included more local ones like the History of Science conference, as well as one at the European level, like the one of Geography of Innovation conference. The work carried out highlights the need to broaden the study of gender equality in academic conferences, not only regarding participation, but also the performance of different roles and functions. The use of multidisciplinary working groups has allowed us to have a more comprehensive vision of the different approaches to the gender gap. We want to emphasize the relevance of classifying these indicators into 3 dimensions: participation, organizational structure, and attitudes. This classification allows for analysis both individually and in combination. Having the indicators classified in these 3 dimensions make it easier to adapt the evaluation tool to all possible conferences contexts, whether online or in real time. That is something very interesting in the post-COVID-19 era. Additionally, a tool to monitor academic events needs to be usable in different disciplines. Therefore, the applicability of our tool facilitates its use across any disciplines. And finally, achieving balance in conferences requires intentional changes. This tool facilitates focusing on the weakest point of the conference and intentionally implementing the necessary changes. For us, this is very, very important, this kind of changes. Here, you can find a summary of our main initiatives and recommendations. We also any problem? Okay. We distinguish action that should be taken at 3 different moments: pre-event initiatives, during the event, and post-event actions. Pre-event initiatives for us are crucial. It's essential to plan invitation and strategy. Use, for example, database to identify women experts in different fields and expand networks beyond usual cycles. And interesting approach is to invite women first and wait for their confirmation before inviting men. We are doing this kind of recommendations. From a management perspective, forming diverse organizing teams and promoting women's participation and visibility within them are also crucial steps. Provide flexible registrations formats and timetable, as well as facilities for family balance, such as breastfeeding rooms or kindergartens are crucial. During the events, it's important to have an event policy with an ethical code of conduct and anti-harassment policy. Developing a protocol for chairs to encourage female participation, we consider that is also valuable according with our data. Emphasizing participation and promoting a balanced use of time are also necessary. And also it's important to analyze the event after the event, and we consider that evaluation is key. I update protocols and guidelines based on any problems during the event is fundamental for the development of future conferences. So thank you for your attention. Our second paper with all the initiatives and recommendations is under review. So once it becomes available, we will be happy to share in our social media. Thank you for your attention.
Thank you so very much. And our final presentation is by Dr. Sarvenaz Sarabipour.
Thank you very much for the invitation, and thank you to Doctors Bernard, O'Connor, Simoni, and Godwa for organizing this fantastic workshop. I'm really, really excited to be here. So my name is Sarvenaz. I'm an assistant professor at University of Connecticut, School of Medicine, and I work in the Department of Cell Biology. I would like to talk to you today about some of my work in the area of research culture. And I will touch on some of the data that I collected with my colleagues on the impact of in-person conferences before the pandemic, and some of the data on the performance of virtual conferences, and what is important really from the point of view of early career researchers who are graduate students, postdoctoral fellows, and early career faculty, and how we can move forward in improving organization of conferences. Now, before the pandemic, I and a number of colleagues examined 270 in-person conferences that were organized over the years, over the span of a couple of years, in a wide range of disciplines. And we looked at the conference websites to collect the data as our source of information. We found that each conference could have up to 30,000 attendees, and the total number of attendees were over 850,000 academics. We also showed that by using CO2 calculators online, that these conferences collectively generated multiple millions tons of carbon dioxide, that very few, based on their website, had any sort of green initiatives or sustainability agendas planned on the site, and they were quite expensive to attend. So this is the average cost per attendees, a few thousand US$. Very few had any plans to promote early career researchers actively, and very few organized networking workshops based on the data that we saw. on their website, and very few took considerations of diversity in terms of gender diversity for organizers or speakers. And these conferences on the right, as you can see in the figure, were all organized by publishing industries, journals, scientific societies, funding agencies, other corporations, and also universities. So they all participated in this manner of conferencing. Now, we also found other issues with these conferences. We created a database that is cited in this article and also on the preprint version of this article. And this database has the list of these 270 conferences, the link to their website, and some of the features that I have shown you in aggregate here. We found that very few also offered career development workshops or had any outreach activities to engage with people on site, for example, the public or other academics in the city that the conference was held. And most actually interestingly provided electronic programs, so there was really no need to print and create the carbon footprint. That way, very few had any sort of caregiver grants or offered any sort of childcare services or nursing rooms. It's of course not clear if upon request there were any sort of facilitation of these services, but on their website, there was clearly none of these really offered for majority of these conferences. On the right in the figure, you can see the breakdown of statistics on gender parity in terms of number of women that were conference chairs, session chairs, keynote speakers, plenary speakers. Some conferences call these featured speakers, and or in terms of organizing committee and scientific sessions. Not sure if my slides are advancing at the moment. So this slide I think I am. This slide basically shows that the data that we were able to collate from the United Nations website on the gross minimum annual wage overall worldwide. And as you can see, the average cost of conferencing that we calculated to be about $1,500 US is way more than the gross minimum annual wage for many countries, for researchers in many countries. And for example, an expensive conference, which would be $3,000 to $4,000, would be a few months of salaries of academics in many nations worldwide. We also did an estimate of total cost of the 270 conferences, and it was in excess of $1.3 billion US, which is the money that was provided by funding agencies and universities. This is the taxpayer money that was basically paid for those researchers to attend this conference, and it's a large sum of money. It begs the question of whether what these conferences actually achieve and what their impact really is on science, and also why the considerations of inclusivity are not really there for many of them. These funds could have fostered collaborations in other ways. They could have been grants for early career researchers and so on. We also tried to visualize the carbon footprint of travel, international conference travel. We have 4 panels here, and the blue dots represent the initial flight location and destination, and the brown color represents the equivalent carbon dioxide produced in a year per capita. And as you can see, a flight from and to the conference internationally, one flight, one attendee's carbon footprint is equivalent to annual carbon footprint produced per capita by many tens of countries. And the longer the distance, the more the footprint. Now, finally, in terms of the challenges of in-person conferences, we wanted to visualize what the visa issues are. In the pink or magenta color, you can see the country of the academics, the passport holding countries, and you can see in green the countries that passport holder is allowed to travel without a visa. It would take months to obtain even a visitor visa. As you can see, there is inequity in how academics from that hold the passport of these countries in pink have in access to conferences that are held in countries in green colors. So visa issues are quite pervasive in science communication. Now, in a second study, I was able to communicate with a number of conferences after the pandemic and obtain data on the state of attendance for the virtual conferences. As you can see in light color, you can see the number of participants and the countries represented, in light for virtual format, and in brown color you have the in-person statistics. And as you can see, virtual conferences have made science communication more inclusive, as previous speakers and Dr. Bernard and Simone also touched upon earlier. I also was able to get other data in terms of participation by graduate students, postdoctoral researchers, early career faculty, full faculty from a number of scientific societies. And as you can see in light color, we have participation in virtual format, which is multiple times higher, 3 to 10 times higher compared to the darker color, which is the in-person conferences pre-pandemic. And finally, looking at the statistics in a different way in terms of conferences that provided statistics by continent, you can see that compared to the researcher population, we are able to achieve more diversity in the 2020 conferences that were virtual compared to the 2019 conferences that are at the bottom of this panel. So there is great promise in terms of achieving better diversity in many ways. Now, what can we think about for the future beyond the pandemic? There are a lot of considerations that can help make conferences open access and inclusive. Some of these are sharing the material that is produced in terms of abstracts or short papers on preprint servers, such as Open Science Framework, bioRxiv, and medRxiv. These, I think, need to be promoted by organizers and colleagues in the conference. I think we know that the largest population of researchers are early career researchers in academia, trainees, and early career faculty. There has to be more promotion of them, sponsorship of them, creating better collaborative environment for them. And conferences also need to release meeting statistics. I think that's something that is not widely practiced. Really. My colleagues touched upon other things that can be improved really in terms of location and finances. Finally, I want to mention that there is a very cool initiative between some of the conference and online seminar organizers and the preprint servers bioRxiv and medRxiv. As you can see, conference organizers after the meetings can team up with bioRxiv and medRxiv and link the recording of the speakers' talk to their preprint, so that when these speakers later want to highlight their work or apply for jobs, then their other colleagues can actually see them and hear their talk ahead of times. So this is, I think, if widely adopted, can be really helpful. And a conference that I helped organize virtually, Neuromatch, has pioneered this collaboration with bioRxiv. So I would be very excited to hear what the thoughts are of the audiences and speakers on these. I would personally, and my other colleagues would like to see a blueprint, a basic framework for how conferences can take into consideration a variety of aspects and help everyone present their science and network and enjoy the meetings, as opposed to going back to what was, being practiced for decades. And thank you very much for your time, and looking forward to the questions.
Thank you so much. 3 really lovely talks. I'm going to ask all of the speakers to turn on their cameras, and we're going to go into the Q&A portion of this. Just as a reminder, you can use the Q&A function to submit your questions. Those will be visible to me as the moderator and to the speakers, but not to the rest of the audience. And we'll try, as I said, to get to as many as we can. We probably won't be able to get to all. There are a couple of clarifying questions that came in while presentations were being made, however, that I wanted to just raise. Sarvenaz, and let me mention, I asked in advance whether it's okay to use people's first names. I'm not being disrespectful. Sarvenaz, there's a question. The questioner says that they were surprised that only 20% of in-person conferences organize networking events. What's the definition of networking events used? Does it include coffee breaks, meals, poster sessions, and exhibit halls?
Thank you for the question. So the networking events were events that were dedicated time, space, that were dedicated to make senior researchers and early career researchers really interact. Something that that kind of worries me about in-person conferences is that everything is left to chance and random meetings. And I think you mentioned earlier, that is not really the way to overcome a lot of barriers and hesitancies in terms of really interacting. And people stay siloed in their own network and they don't really interact. So we just used everything that was available on the website, and then that information would be dedicated networking events, not meetings at coffee or lunch.
Thank you. And then Carmen, a question that came up while you were speaking is, can you talk about the degree to which the indicators of gender balance correlate with subjective feelings of belonging and comfort among women?
Thank you for the question. I think that gender balance indicators like equal representation, I think that correlate significantly with women's sense of belonging and comfort. I think that when women see themselves represented and supported in different roles, it creates a positive environment where they feel valued and included. So I think that promoting gender equity is key to making women feel part of the community and the academia and the event environment.
Okay. And then going broader, kind of building upon that, I hope that each of you could address this briefly, would be, how do we uphold principles of DEIAB at conferences? How does this vary between the virtual and the in-person conference environment? Who wants to go first?
I put an answer in the answer box, but I can't quite see it again, but I did type a message back to that. I'm happy to reiterate it. I feel, and the point that was made before regarding majority of speakers hold PhDs or MDs, I think it's important of how we assign value. And if we assign value to those who hold these titles only, we're potentially missing out on others who have experience that is equally valid, some would argue more so, in terms of actually getting to the core of the problem. I think about the clinical component of our respective sciences, and the need to understand some of the nuances, which is not always clear when you are researching from afar. And I think of this in terms of global health and understanding that we often work with individuals who do not necessarily hold the degrees mentioned, but we are absolutely guided by. And assigning the word expert or the label expert to that person, I think, is an important first step. How those individuals then are able to participate in these spaces, I think conferences need to start accommodating for that, and some do. So I think one of the main things is to redefine how we assign value and also who we call experts.
Carmen, Sarvenaz, do you have other thoughts?
It's more or less that he told us. Yes, I can't hear properly. Sorry.
No problem. Let's go to another question, which is something I hadn't really thought about. Recording talks and preserving them for future watching sounds wonderful, but as implications for data that includes people's voices and images, central to many fields' work. How can we think about the balance between privacy, safety, and flexibility in viewing talks in asynchronous formats?
I think I mentioned that recordings of the talks can be linked to preprints. I think that because of the time zone issue that you mentioned, it's really beneficial to have the recordings. But I think that the organizers can set strict guidelines, and clarify with the presenters that where the recordings will be stored and for how long, and also what the rules are on data mining, for example, or sharing the data, really. But other than that, I think it's also can be should be really an opt-in, basically service or mechanism. And also, I think it is up to the organizers to create the kind of positive and collegial environment where people feel safe and they know that they know every step, and they know that what will happen to their paper or the recording of their talk. But it can only be beneficial, and more people will listen to it in their own time after the meeting. I think data has shown.
Great. Any do either of the other speakers want to add to that?
I'm in agreement with those sentiments. I often think about the responsibility of us in the academic community to not abuse the good nature of those who are willing to share their data before publication. One would hope that also the conferences who do have these presentations or access to the data put it behind some level of login, so that at least there is some understanding of who's accessing what in the event that unfortunate circumstance should come about. So I think providing some constraints to it, but also allowing speakers to provide some supplementary reading, so that in the event that people are looking at presentations asynchronously, there is some understanding of context is provided.
Okay. The next question, and I'm going to ask each of you to address this in whatever way you choose to think about it. Many scientific conferences and meetings now include explicit policies, including enabling DEIAB principles, like a code of conduct. So what are your thoughts on the utility of these policy measures for promoting a more inclusive conference experience? And maybe I will just kind of call on you. So I'll start with Sarvenaz, and then I'll go with Carmen, and then I'll go with Michelle. How's that work?
I think that's a really great question. And I've also noticed the increase in these statements. I think this relates to a point that I had in my slide, which is that conference organizers need to provide the statistics on the meeting, after the meeting, so that we know actually what the policies that what they implemented, worked, and what the outcome was. Also, it may be longitudinal, so that over the years we can monitor and see if in 5 years they have really achieved what they set out to, and what that really has meant. So I think unless we have those data, especially longitudinal data, that, for example, can be reported back to funders of these conferences, we won't really be able to see the wider spread impact of these policies.
Carmen?
Yeah, I completely agree with that. I think that we need to hear the audience, for example, with metrics, but also with qualitative studies to gather this insight of the different experience of attendees. I think that is very important, this kind of longitudinal studies with the conference that for me we are doing this kind of work, but it's really difficult. But I think that is crucial for the diversity in the conferences to have data, metrics, and qualitative studies.
Michelle?
Yeah, I think that's a great question. So one of the things that we've tried to do through our series of studies is to understand what the indicators are and identify what the metrics are as it relates to having active engagement at conferences, and assigning a value to them, assigning a number that allows for an index to be built. I think it's very hard for conferences to stay in their bubble sometimes and compare their year to year, but by having access to wider conference data to understand how others have been able to achieve equity, then I think there is capabilities for accelerating improvements and narrowing the gaps in equity. Having what we're trying to build is this dashboard of interactive engagement for putting in your conference data and it telling you how equitable your conference is, I think is something that is tangible. I think we need innovation in this space. Innovation to help conferences. There is a will, but there are challenges that are complex and constrained by finances often to achieving full level of equity that they desire.
So here's an innovative approach. The question, often at any type of conference, there's little time for questions. Have any of the speakers ever seen something like the following? Ask the conference attendees to listen to a 20-minute video or podcast about the presenter's research ahead of time. And then at the conference, host a 30-minute question and answer period only. The flipped classroom approach, but at a conference level. Have any of you experienced that?
No, I don't, but I think that is a really good idea. I'm kind of fan of flipped classroom, so maybe it's a good improvement. Yeah, I didn't think about that, but it's a good idea.
Michelle, Sarvenaz?
I think that's the kind of innovation that is required, right? I think that's a fantastic idea. I also think that it would actually be very liked, approved by conferences, because it cuts down some of the logistical costs that they have. Being able to step into a room, where, be it virtually or in person, where you can engage in dynamic conversation is where the collaboration happens, is where the growth happens, but you don't often get that time, and then the speaker's gone. So I think that's a fantastic idea, the flipped classroom approach. I like that very much.
Sarvenaz?
I completely agree with my colleagues. I think that right away with virtual conferencing, there is more opportunity to even type your question so that the speaker may see it, compared to in person, where two people are, in front of a queue and can really ask questions. But I really like this idea where the presentation is watched, and then the time is really for interaction. The conference time is really for interaction. I think it's a great idea.
Okay, I'm going to be Debbie Downer. I've had an N of 1 experience with that, where they were supposed to look seeing the presentation in advance and come with questions, it really didn't work. The people didn't look at it in advance. So you're gonna have to have a motivated audience. But I like the creativity around it, and I think that we do need to be looking at differing ways of doing these things. So another question, broad question for each of you, and I think I'll start with you, Carmen, and then you, Michelle, and then you, Sarvenaz. We've heard your presentations, and in the broader literature, the virtual conferences have greatly broadened the diversity of attendees and expanded conference access to groups that are traditionally underrepresented in science. Yet there are many advantages of in-person meetings, from networking to scientific innovation, potentially, which could benefit underrepresented groups in science as well. So how should we be thinking about the trade-offs in inclusivity, connection, and innovation with these different formats, virtual, hybrid, and in-person? It's a mouthful, but strengths versus weaknesses of the three different ways of doing this, and what should we be thinking about? So Carmen, do you want to start?
Yeah, I think that it's a good question and a difficult one. Yeah. I think that both conferences have strengths and limitations. And of course, if you do, I think that virtual have advantages like a broad access or the flexibility that is very beneficial for those with family commitments or in a different part of the world. But it's true that we are losing the person interaction that for me is very, very important. And also we always have technical barriers. So I think that it's really difficult for me to have a right answer about that.
Michelle, your turn.
I just want to make sure I understood the question correctly. You're asking if the strengths and the barriers to utilizing
the trade-offs.
the trade-offs, right?
How should you be thinking about these? Yeah.
So I think about it from two perspectives, one from the participant's perspective and the other from the conference organizer, maybe even the third, another from the sponsor. From the participant's perspective, if you are able to afford to get to a conference, there is a strong desire for taking advantage of the networking opportunity that it affords you, especially if you are junior and you're not well established, because it is the coffee side conversations that potentially is where you get your next posting, your next postdoc job, versus in the virtual space where it's harder for you to really demonstrate the body language that you have. The interactions are just much more natural when in person. I do understand that the trade-off, of course, is, all of us watching our carbon footprint, watching our finances, and also the systemic barriers which you have no control of in terms of visa access and technology. Hybrid conferences, from a conference organizer's perspective, are incredibly costly to run because you have to do both well. In-person participants have to engage and feel that they've spent their time and money worth getting what they wanted out of the conference, and equally those virtually want to make sure they are able to participate at a level that is close to what is happening in person. For fully virtual, I would say, in principle, if everyone was on a level playing field as it related to access, it seems like a good option. It helps those who can potentially catch up if you're not in the same time zone. It helps in terms of dissemination of knowledge. The area where there are limitations are in networking, but also in those who are unable to attain the level of access, be it, unstable internet, unstable electricity. There are boundaries that prohibit them from engaging in a way that they would have otherwise have liked. Each one has advantages and disadvantages, but I think all can be taken advantage of if done in the right way.
Sarvenaz?
Yes, I think it is a very important question, but also the way I've been thinking about it is that I think that beyond the pandemic, we have to actually reassess how we collaborate and communicate science. I think that there are two sides to it. One is the organizers. I do think that they need to put a lot more initiative and be proactive into providing different ways of communication at conferences and accommodating people. Also, what the goal of the meeting really is. If it's a small community rare disease meeting, yes, maybe it could be online. I think something that was mentioned in the chat was alternating and not holding the conferences every year if it's environmentally and financially costly. I also think that funders need to have some oversight on how the meetings are structured, and I haven't seen that really, that level of oversight from funding agencies or universities on meetings. On the researcher side, I really think that we need to be ourselves more active and feel the agency to network throughout the year and really collaborate throughout the year and not leave it to chance at conferences. I have attended many in-person conferences, and in most of them, they had no consequence on my career. And I feel that for a lot of early career researchers in whatever field they are. So I think that we need to actually take it of ourselves, contact people that we are interested in their work, and also make ourselves visible. I run a Slack community of thousands of postdoctoral researchers, and we network throughout the year. And there are similar communities for faculty and graduate students. And the second thing is the initiative with bioRxiv. I actually initiated that because I felt that our presentation should be visible throughout the year, not in a single event and seen randomly by a couple of people. So I think that both as researchers and organizers, we have to reimagine this and make conferences continuous so that they are not a single event and they are not forgotten and gone. That is my perspective on this.
Fabulous. Okay, it's hard to believe, but I think we have time for maybe two, maybe even getting three. We'll see. But I'd like each of you to try to address the next couple of questions I'm going to present. And I guess we'll start with you again, Sarvenaz, because we had Michelle to start in the last one. So this question is about the benefits of virtual networking. In general, what's the benefit of it as a researcher? How does virtual networking compare with presentational sessions in terms of its impact on underrepresented groups feeling like they belong? So Sarvenaz, and then Carmen, and then Michelle.
So I can say that at virtual conferences, I have been able to, and I've seen a lot of people being able to post questions and share contact for future interactions with researchers. So I think that's a really good start. I know that some conferences, for example, Neuromatch conferences in computational neuroscience, have established websites for continuous collaboration too. And they also have a summer workshop where senior researchers can interact with graduate students and postdoctoral researchers and undergraduates. So they make it an academy, kind of an initiative. And it's very interesting because those organizations, they are grassroots organizations. They're not major scientific societies. They're not universities. They're not funders. And I would like to see this from the major players too. The organizations with the largest money, they need to actually listen to the scientific community and make things possible throughout the year, not in a single event that is sponsored by a pharmaceutical company. In terms of other ways of networking, I think Slack communities became very popular after the pandemic. And there are now communities where people can ask their most pressing research questions or just interact in terms of other aspects of science and research culture. And if people are interested, I think Grad Slack is one of these communities where graduate students are interacting. Future PI Slack is one of them for postdoctoral researchers. So I think that these are way more democratized, way more dynamic and relevant, really. and they increase transparency in how we do research and how we deal with research culture. So I would like to see the traditional avenues that have organized conferences really step into this and contribute some of that funding into avenues where people actually interact continuously throughout the year. So I'm a big fan of virtual networking.
Carmen?
Yeah, I'm also part of several Slack communities, and I think that is part of the future of the scientific community. It's very, very important for the interactions. And as my colleague said, that it's not just a single event. You need to think about that in, in a broad sense. For me, Slack communities, open communities, forum, is a it's kind of a virtual networking that I'm as a postdoc mm, putting value a lot, and I think that is very important.
And Michelle?
I really like the idea of having opportunities to engage over various Slack communities, because it does cut out some of the red tape that one sometimes faces when trying to engage. In respects to global health, there are various platforms that we use that seem to be very helpful. WhatsApp community, being able to have different groups of high numbers of individuals. We don't have thousands, but again, it's an opportunity to engage where you are leveling out the playing field, which is important. So yeah, I think it's a way forward that we should be embracing these different mediums in the hope that we can sort of narrow the disconnect between engagement and the lack of.
Okay, I think we're at our last question because I promised everyone we were going to finish on time. So again, I'm going to ask each of you to address this. So it'll be Carmen, Michelle, and then Sarvenaz. What is a key research gap in advancing DEIAB in scientific convenings? We have NIH sponsoring this. We do a lot of research. What should we be looking at? Carmen?
Yeah, I think that is a great question and also a really difficult one. But for me, the most important point is to evaluate the long-term impact of all of these initiatives from the diversity point of view. For us as a group, as I told you before, it could be very useful to do a longitudinal study with the conferences that we have been working and trying to evaluate these 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 changes. And also, I think that it's very important that we need spaces like this one to compare and share strategies, because it's always good to identify best practices or things that we are doing in a different way. So, and a final remark, I think that we need to hear the audience, for example, with qualitative studies or the different experiences. I think that identify these barriers and is a good way to for the participation of underrepresented groups and to work for the diversity in conferences.
Great, thank you. Michelle?
I think one of the things I think about are those who come after us and the need for opportunities for early active engagement. Being able to track how we do that and who gets involved and the impact it's made, and doing some form of longitudinal assessment holds us accountable. And it also means we get to follow people on their journey and identify how the different sort of modes of establishing more equitable access, more diversity, not just by presence and sight, but actually meaningful, how that has impacted your ability to contribute to your scientific field? Has it made a difference? Yeah.
Sarvenaz.
I agree with my colleagues. I think that sharing it of the data statistics by organizers is very important, and doing it longitudinally is also very important. I also think that, I think I mentioned this earlier, that I think there has to be some incentives and oversights by funders and big players on this too. For example, I think a lot of these, the microenvironments are run by senior researchers at these conferences. They're big figures in their field. And then a lot of things cascade from them, really. And so they're at the top of a pyramid. And I think that funding agencies could ask them in their next grant, what have you done in conferences in the past 5 years, and who has it benefited really? Have you initiated any collaborations with younger researchers? Have you impacted, have you mentored anyone really, virtually or in person? So I think there are a lot of data that funders can collect really, or universities, and counting as service and promotion as well in their tenure and promotion, to see how people are really contributing to a conference. I think quantitative data from organizers are important, but there are later impacts of attending a conference, and it would be good to see if they are amplified virtually, and if people are really having an impact scientifically and mentorship wise on their colleagues and younger, more early career researcher. I would like to see those and I think that would also set an example, a great example, that things are being seen, that things are being taken into consideration, and that your impact at a conference is more than the paper you present. This is more than just the science that you talk about for 10 minutes.
Very thoughtful feedback from all three of you, and I hope that we will be able to address some, if not all of that. Okay, we have 4 minutes left, and so I'm going to really put pressure on you, just like we do with our scientific workforce diversity seminars. I'm going to go around to each of the three of you, and in 30 seconds or less, tell this audience the one thing you want to make sure that they remember from what you presented today. And I think I'll start with you, Michelle, then Sarvenaz, and then Carmen. Okay, Michelle.
It's up to all of us to establish equity at these conferences and to be inclusive in all of our practices, from authorship engagement to speaking opportunities to bringing our juniors along. I would encourage you to identify what the metrics are if you are a conference organizer yourself, to start thinking about what you can measure and what your low-hanging fruit is that you could potentially harness to narrow the gaps that you see.
Thank you. Sarvenaz.
I think that we have the agency to make an impact in our career, and we have to seek opportunities and also share what we have with others. So be a mentor, receive mentorship continuously, and also ask for more from organizers. I think that's something that a lot of researchers haven't done so far. See the issues. I hope my slides and my colleagues have shown the issues really, that they are pervasive and they cut short our career. And we all want the excitement of science, and we want opportunities with it too. So I think it's really up to us to go find it, but also ask organizers, funders, and universities to offer it to us as well. So I hope to see that empowerment and that contribution from other players.
Carmen, you get the last word before I do some closing remarks.
Just one word: promote and think about diversity when you are in a conference, when you are organizing a conference, and take into account all the different groups that are part of these events, because we need to be part of them and feel that we belong to the community.
Thank you so much, all three of you. Just wonderful talks, wonderful thoughts. I want to thank you and the audience for participating in this. This concludes our panel on cultivating inclusivity, advancing diversity and equity in scientific convenings. The next set of concurrent sessions will begin at 2:30 Eastern Daylight Time. In this track, the next session will focus on creating inclusive conference environments through disability inclusion and accessibility, a fireside chat. In track 2, the next session will focus on redefining conferences, innovative formats for sustainable engagement. To join the session of your choice, navigate to the auditorium and select the track that you would like to attend. So again, thank you for joining us, and this concludes our session.
Thank you.